Hello. Do you know your blood type? Don't worry, many people don't. Even if you know the type of blood that runs through your veins and arteries, you may not realize that depending on your blood type, you may be more susceptible to certain conditions and even some types of diseases more than people with other blood types. And there is a blood type that is the most dangerous of all. Do you have this blood type? We hope not. In this video, I will talk about blood types and diseases related to some blood types, whether the blood type diet is scientifically proven, and you will learn everything about the most dangerous blood type in the world. So, stay tuned. My blood type is type B if it has the B antigen on its red blood cells, type AB if it has both antigens, or type O if it has neither. The other classification depends on the presence or absence of a protein called the Rh factor, which can be present, plus, or absent. From these two classifications, the most common blood types are formed, which are A plus or, B plus or, O plus, O, and AB plus or. Why is it important for us to know our blood type? Basically, if we need a blood transfusion or we are going to donate our blood to a person in need, message here, it can mean the difference between life and death. Why does the person need blood? Because they have suffered an accident and lost a lot of blood. If they are going to undergo major surgery where they will lose a lot of blood, sometimes the surgeon requests to keep a few bags of blood in case they need to use it. Also, in the case of premature babies, people undergoing cancer or leukemia treatment, and pregnant women who have lost a lot of blood during childbirth, there are several reasons for the need for blood transfusions. For people with rare blood types, especially AB and O types, the stock in the blood bank may be limited. Although O is not very rare, about 7% of the population has it. It is a universal red blood cell donor because it does not have any surface antigens, no A or B antigens, and no Rh factor, so the recipient's body, the carrier, will allow it to pass smoothly. Therefore, O-negative blood type can donate red blood cells to anyone, and this blood is often used in emergency situations, which is why it is the most scarce blood type in blood centers, but the negative side is that you can only receive this type. AB plus is the universal plasma donor, as it does not contain antibodies against A or B antigens, and can receive blood from anyone. Remember that your immune system will continue, and will produce antibodies against any antigen that is not present in your blood. So a person with blood type B receiving blood type A will have an ABO incompatibility reaction, which can be fatal because the patient's plasma antibodies against A recognize the A antigens on the donated red blood cells, causing clumping of red blood cells and impeding circulation. How was your blood type determined? You inherited it from your parents. We inherit one copy of each gene from our mother and father. This is what determines your blood type. For example, my blood type at home is B+, and my wife's is also B+. We can only have children of type B or O, because the O allele is recessive, and that's exactly what happened. My daughter is O and my son is B negative. So if the type A came up, either it was changed in the delivery room or he wasn't my son. In addition to the antigens mentioned, there are 600 other known types. Their presence or absence can create rare blood types. Fortunately for us, the vast majority have antigens that do not affect our ability to receive or donate blood. However, not everyone is lucky. Imagine if your blood was very rare, so rare that only 1 in 6 million people could help you if you needed a blood transfusion, if you were in an accident, needed major surgery, or suffered from severe anemia. Or was the delivery slower? Complicated? Categorized, less than 50 people in the world have this blood type. And what is the blood type considered the most dangerous ever? It's the empty Rh value or the golden blood. Despite its name, golden blood has no advantage. In addition to the rarity of red blood cells, it tends to be more fragile than usual. If you are one of the few people who do not have the Rh factor, you cannot receive blood from anyone else except for rare donors of the same blood type. Oh, I am Rh negative, am I Rh empty? As you can see, even if you are Rh negative, you still have some Rh proteins. Certainly, you have a few, but you still have something, or else you would be Rh positive. If you are Rh null, you do not have any of the 61 possible Rh system antigens. Therefore, in golden blood, there is a complete absence of Rh system antigens for red blood cells. This absence is what makes these individuals extremely rare. Most people with this blood type do not even know they have it. And if you want to know who they are, know that the information is confidential, but we are aware that blood donation has already been made among them. And do you know your blood type? If you don't know, how do you know that? Is it through a complete blood count? No, because a complete blood count will only show us red blood cells, white blood cells, and platelets, so you won't be able to know your blood type. Therefore, if you are going to look at old blood tests, try to find out your blood type, ABO, and Rh. Look for this information. If you can't find it, either you have a specific blood type test or you can donate blood. So, look for the nearest blood center. If you are over 18 years old and under 70 years old, you can donate if you are over 16 with permission from the responsible person. If you have not a contagious disease, such as syphilis, HIV, hepatitis, or malaria, you can donate every 2 months if you are a man or every 3 months if you are a woman. Now, I will talk about the distinctive characteristics of each blood type. First, I will comment on the diet of each blood type. Is there any scientific evidence? Advocates of this diet claim that depending on your blood type, some foods are better for your health than others. Where did this come from? From a book from the 90s called Eat Right for Your Type, which became one of the best-selling books. Basically, it said that type O comes from hunters, so people with this blood type should eat more proteins like meat, poultry, and fish, and limit some grains and legumes, and it looks like a paleo diet. Type A, the second most common blood type, is agricultural, and should stay away from red meat and eat a diet similar to vegetarians. Blood type B was called nomadic. These people can eat vegetables and most meats, avoid chicken and pork, and can also eat some dairy products. They should also avoid wheat, corn, lentils, and tomatoes. Finally, type AB was called enigmatic, a combination of type A and type B. However, one study found no correlation between blood type and personality. But what about diseases? Could they be linked to blood type? It seems so. For example, heart disease. A study by Harvard University revealed that type O has a lower risk of heart disease, and the most dangerous blood type for heart disease is type AB. The most important thing is to check your blood pressure, glucose, cholesterol, and lifestyle habits. Another advantage of type O is a lower risk of stroke. It should have the same rule of thumb. But not everything is rosy. Type O seems more prone to ulcers and skin cancer. People with type A blood are more prone to stomach cancer. It seems to be related to H. pylori. Also, people with type A blood tend to have higher cortisol levels, a stress hormone. And people with type AB are more prone to memory loss and dementia. But honestly, you can't change your blood type, my blood type, but you can change your lifestyle. Eat better, exercise more, avoid addictions like smoking, reduce stress, try to sleep better, and enjoy your life the way it's meant to be lived. Did you like the video? Remember to subscribe and even the next video. Thank you very much.